start. So, yes, so today we will be dealing with pharmacodynamics. This is the third session we are going with. Like, we started pharmacology and we have dealt with what is pharmacology, what are drug, what are the dosage forms, what are the routes of administration, etc. Then we dealt with pharmacokinetics, that is what the body does to the drug, that is ADME, absorption, distribution, metabolism, and elimination. Now we'll be dealing with pharmacodynamics. Now we know when when this D comes first, that is D. That is, what does that mean? What the drug does to the body. So now we'll be seeing that what this drug will do to the body. Okay, so let's see that. So basically we'll first see what is the definition of pharmacodynamics. We know what it is. It is basically that what the drug is doing to the body. We'll be studying that in the previous lectures. We study that, let's suppose when the drug is coming, what the body is doing with it, how it is absorbing it, how it is making it to reach the site where it should perform its action. Then we saw after the action how it is metabolizing it, and after metabolizing how it is eliminated from the body once the work is done. But today it's about the drug. We'll be seeing what this drug does to the body. So, pharmacodynamics is nothing but biochemical or physiological effect of drug and their mechanism of action. Okay, I hope it's clear that what is pharmacodynamics. It is nothing but biochemical and physical effect of drug and their mechanism of action. In this whole pharmacodynamics, like what are the topics we'll be studying, I'll just give a short overview of it. Okay, so we'll be dealing with, first of all, mechanism of drug action, then dose response relationship, then what are the receptor types, what are the factors influencing the drug action, and why it is relevant, like what is the clinical relevance of studying all of this. Like, we know we are going to be a doctor, then why we are studying these about the drugs, why we are studying the pharmacodynamics. So we'll be studying the relevance of it. Okay, so pharmacodynamics is what? It is the study of what the drug does to the body. It will basically explain the biochemical and physiological effect of drug and their mechanism of action. Okay, so let's begin with the mechanism of drug action. Okay, so see, sorry, what are the drug actions? Let's suppose that this is a particular man, and this man was facing, yes, let's suppose this man was having fever since 5 days. Okay, he has fever since 5 days. He visited a doctor, and the doctor gave some certain medicines. Okay, the doctor gave certain medicines. He gave any drug. Now, what this drug will do to the body? So, see, although in this condition the doctor might have prescribed any medicine which will lower the body temperature, and depending upon the cause, what is the cause of the fever, the doctor might have given other medications too. Okay, so the basic action that any drug do, so whatever drug is which is available in for us to give to the patients, all the drugs has certain basic action. What it has? It has certain basic action. What are these action? Let's see that. So first of all, a drug can be stimulator. Like, it will be stimulating. What it will be doing? It will be stimulating. Okay, so stimulation is one of the basic action. Now we know what we said. What is pharmacodynamics, what is pharmacokinetics, what is pharmacology? It is nothing but the study of the interaction of the drug and body. And what we talk about body is what? Anatomically, it has been it is having different structures, whereas the function is what? Physiological state is the function. And whenever there is any kind of disturbance on any kind of pathogen enters, or anything that happens, what it causes, there is a pathological state, isn't it? So what actually body, like in modern science, what we perceive that the body is full of biochemical actions going on, isn't it? Let's suppose if I'm able to see an object right now, then we know that how do they explain about the rhodopsin and iodopsin, how these pigments are working, isn't it? If I'm talking about, if I'm having food, if I'm taking carbohydrate, then how it is getting digested, the mechanism, the cycles which are going on, which is breaking it down into glucose, then it is forming ATP, and how this ATP is giving me energy, right? So the whole modern science concept depends upon what? Biochemical reactions. So let's suppose if I'm talking about any particular reaction, that A is breaking down into B plus C. Okay, A is breaking down into B plus C. This is a reaction. This is a very simpler reaction, that A is getting broken down into B plus C. So what this stimulator drug will do, if I'm giving any drug which is acting as a stimulator, what it will do, it will promote or enhance the activity of this particular cell, of this particular action. Okay, let's suppose in my body this particular reaction is going on, then it will be doing what? It will be just enhancing it. Okay, so we know that we have kidneys, two kidneys, and there is an adrenal this adrenal glands on the kidneys, right? So what it secretes? It secretes adrenaline, right? And this adrenaline does what? It stimulates the heart. It stimulates the heart. So any drug, let's suppose any drug which I'm giving, which will do what? It will act like, it will act like adrenaline stimulator. So it will do what? It will stimulate the heart. So for the basic action, the first basic action is clear, that is stimulation. So any drug will do what? Stimulation. The second one is depression. Now it is understandable what will happen. Just imagine about the chemical reactions going on in body, and any of the reaction getting depressed by any of the drug, it will be what? Depression. The basic action, one of the example we can take is of omeprazole. Okay, what it does, it depresses the gastric acid secretion in the stomach. Okay, omeprazole is doing what? It is suppressing the secretion of the gastric acid. Now the third basic action that we can say that any drug can perform is what? The third reaction action is irritation. Any drug can even perform irritation. Now we know there are certain drugs which will act as irritant, and mostly like it is non-selective. Okay, this irritant can be harmful, like it can produce a mild harmful effect, but it will be like indeed a useful effect only. So okay, so irritations can be there. It may lead to inflammation, corrosion, necrosis, but mild irritation can stimulate certain functions. Like if we talk about bitter taste food, okay, bitter taste food, what it does, it will increase the salivary secretions and the gastric secretions. Okay, so although it is an irritant, but what it is doing, it is helping in increasing the secretion of saliva and gastric juice. Okay, now the fourth example is replacement. Now again, if a chemical reaction is going on, then definitely you can replace one reagent with the another reagent, right? Similarly, and what if, let's suppose that there was a chemical reaction going on, A plus B becoming into C. Now suddenly there is no B. So how this conjugation will happen? How it is going to there? No, it won't be there. So if it has been finished, like we can say there is deficiency of B, then what we will do? We will supplement it. Or we will replace it. Or we will do what? Replace it. So this replacement is what? A basic action. Okay, so when we do these replacements, replacements are basically done during any deficiency of anything like hormones or vitamins, etc. Okay, so basically here we can talk about hormones or any in their deficiency state. Like if I'm talking about anemia in diabetes, that is also a replacement action. Okay, the fifth action is cytotoxic action. Now this is the action where antibiotics come into picture. Okay, so cytotoxic actions are what? Like these, when it acts whenever there is invasion of parasite or cancerous cells. Then what will happen? These will kill them without significantly affecting the host cell. Okay, so basically, in any infection, when where any kind of microbe is coming or cancerous cells are there or anything is there, then how a drug can kill it. It will be cytotoxic, it will be killing it. Okay, so all the antibiotics, antifungal, everything will come in this. So the one of the example, you can give any example, let's suppose penicillin. Okay, so these are the basic action of the drug. I'll just repeat from starting what we are studying for those who came late. So we are dealing with pharmacodynamics today. What is dynamics? Dynamics, we know what drug does to the body. Okay, and what is pharmacodynamics? It basically explains the biochemical and physiological effect of drug and their mechanism of action. That how a drug is going to change, how biochemical, how the reactions occurring in the body will be changed, how it will be changing the physiological states and all, how it will be helping in the pathological state reversibility. So all of these things we'll be studying in this particular chapter. Okay, so the first part was what we were dealing with. What are the basic actions a drug can have? Okay, so we know pharmacodynamics, it is drug action. So and one more thing, one very very important thing that we should keep in mind, that only in this the drug can only only alter the pace of ongoing activity. Ongoing activity. It's not like, let's suppose, as I said, that the chemical reactions going on, that will be changed. If A is missing, A will be replaced. If A is working slowly, A will be stimulated. If A is working too much, A will be depressed. If we need some kind of irritation, we will give some kind of irritation. So, and if some invasion is there, we will give cytotoxic actions, but it will never have a new reaction in your body. It will never ever produce a new reaction in your body. That point should be noted. Okay, so it will only alter the pace of the ongoing activity. So these are the actions that a drug can produce in your body. So I hope that all the actions are clear. Now let's move on to the mechanism of drug action. Mechanism, this is the second part of pharmacodynamics. Okay, so mechanism of drug action. What are the mechanism of drug action? See, now this mechanism of drug action is basically of two types. Okay, it is of two types. What are these two types? Either this mechanism will be non-receptor mediated action, there will be non-receptor mediated action, or receptor mediated action. Okay. Now, what does that mean? What does that mean? Like receptor are there or it's not there? See, we know again in body. Let's suppose that if I'm talking about a person is there, that person was constipated since 2 days. Okay. Then that patient came to you and he said that doctor, I'm constipated since 2 days. I'm not able to defecate. So what you did, you asked, okay, what all things you had like in these 2 days, and then the patient said, I had khichdi once, like I had one meal per day, and that was khichdi that I had. So why the person is constipated or why the person is not able to defecate is because there is no bulk in the bulk of the feces is not there, isn't it? So it is not coming out. So what we can do, we can think of creating bulk over there so that the feces can come out, isn't it? It's not there, so it's not coming out. The person is taking only khichdi for one meal per day. So basically the patient is dehydrated, the patient has not taken particular food, like a particular amount of food. So what over here in this case, what we are supposed to do, we are supposed to give something which can create bulk so that he can defecate properly. So over here there are no such receptor involvement going on. So what it is, basically we'll be giving, let's suppose, I hope that all of us know what is husk. This husk, um uh, what we call it as, it's of gold husks. I know, I hope all of us know what we do. We just soak it into water, and we can give to that patient, and after a while it will, because this drug has ability to absorb water and increase mass, it will help to bring out laxative action then, and the constipation may be relieved. Okay, so over here mainly what particular action, what mechanism happened? Was there any receptor involvement? No, there was a physical action happening, isn't it? So these kind of action, physical, chemical, through enzymes and all, then these particular reactions come under what? Non-receptor mediated action. Whereas agonist, antagonist, and partial agonist or inverse agonist, these all comes under receptor mediated action. So I'll just go in detail of this thing, because we have to study this. So non-receptor mediated, in this there won't be any receptor. Okay, there won't be any receptor. So the first one which we can see is, in non receptor mediated, is the physical one, the typical example that I gave about the physical mechanism of action. So uh, basically a physical property of the drug is responsible for this action. Okay, the same example of isofgol can be taken. It can be taken that it will act as a laxative by what? By creating a mask over there. So this is a physical action. Another example, even not only isabgol, you can take another example for it as magnesium sulfate. Magnesium sulfate, now this magnesium sulfate does what? It retains fluid inside the lumen because of what? Osmosis, and thus increases the fecal bulk and brings out laxative action. Okay, so this is also one of the example. The second one is chemical action. Chemical action, again over here receptor involvement is not there. Okay, so over here also the drug reacts extracellularly. Okay, according to simple chemical equations only it will be acting. For example, let's suppose a patient came to you and the patient said, doctor, I am having acidity, I have belching, I have sore belching. Then what it is, it is like clearly we can see that the person is having this acidity due to maybe increase in secretion of HCl or not. So the first line of treatment, what we can do, we can give an antacid. Okay, we can just give an antacid, and we can expect that this antacid, the antacid which I'm talking about, antacid, it is what? It has a high pH. Basically it is alkaline. It is alkaline, and the stomach has what? HCl. So it will be neutralizing it. So this is the chemical action of the antacid. Okay, so I hope that this is clear. Over here also we didn't needed any receptor to do the action. I hope that it is clear that physical action didn't require any receptor, chemical action also didn't require any receptor. Okay, now we will go for the third one. The third one is happening through enzymes. Now we know that yesterday while studying metabolism, we studied that how our liver, the endoplasmic reticulum, how it was having the microsomal enzymes and the non-microsomal enzymes, how and how much it was important to convert these non-polar drugs into polar drugs. Similarly, we have hundreds and thousands of enzymes for doing action. Okay, and we can, the beautiful thing is we can divide all the enzymes into two categories. What are these categories? Stimulating enzymes and inhibiting enzymes. Okay, so stimulators and inhibitors. Okay, I hope that it's clear. So any drug, let's suppose if I'm giving any drug and that drug is if stimulating the enzyme, then it's a stimulation action, and if it is inhibiting, then it's inhibition in action, inhibitor in action. Okay, so stimulation, let's suppose if I'm talking about a drug stimulation, that drug which will what? Stimulate the enzyme, and the rate of reaction will be increased, okay, by stimulating. Whereas inhibiting what? Enzymes, this yeah, it will be inhibiting, and this can be either specific or non-specific. Maybe it is inhibiting a particular enzyme, or maybe it may inhibit a group of enzyme. Okay, so it is like that. Now the fourth one is in non-receptor is the ion, through ion channels, through ion channels. Okay, now drug interfere with movements of ions across the specific channels. Like let's suppose we know how do we have like how many channels do we have, and the most common channels that all of us know, the sodium channels, the potassium channels, right? The sodium and sodium channel, the potassium channel. So what will happen, these drugs are going to affect the ions, affect the ions. Either they won't allow them to go, or either they will be promoting it to go more. So it will be like that. So and also of course calcium blockers, sorry, calcium channels, and of course potassium channels. And we know potassium, we have potassium channel blockers, calcium channel blockers as a medicines, right? So they are doing what, they are blocking these channels. Okay, so this was all about a drug mechanism of action, where no receptors are involved, okay. So these are non receptor mediated action. Now if we talk about receptor mediated action, then what it is, it is of, again, three types. Now what are receptors, first of all? Yes, anyone would like to tell me what are receptors? Anyone? Can anyone tell me what are receptors? A basic definition. What are receptors? Yes. Actually, I have seen that whenever I'm asking, no one is replying, and then I'm like, okay, so this is it. But today I'm not going to do that. So please tell me what are receptors. Anyone? Should I take names? Shamna. Shamna Arvi, can you tell what are receptors? There is too much of silence. Okay. Um, who is Preetha? Preetha, can you tell what are receptors? No. Okay, fine. So, see, receptors are, okay. I got an answer from Xiaomi 231 blah 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 blah. I don't know who it is. Receptors receive and transduce signals. Exactly, it's correct, isn't it? So receptors are basically what? They are specialized target macromolecules. Okay, what are receptors? They are specialized target macromolecules. Where are they present? Where? They are present on the cell surface, or maybe intracellular also. Okay, they're present mainly on the cell surface, or also it can be intracellular. We know that, isn't it? Now, what will happen? It will bind with specific drugs and mediate what? Pharmacological actions. Now, binding of a drug with receptor results in the formation of the drug receptor complex, and it leads to biological responses. Okay, now who gave this receptor substance? Like a concept, this concept of receptor substance was Langley and Ehrlich, I guess. Yeah, Ehrlich and Langley. And Clark basically explained the complete knowledge of drug receptor occupation and all of that. Okay, so all this thing. Now, the thing is, we were dealing with what? Receptor mediated action. So what are these receptor mediated action? We'll see. So these are of three type. What are these three type? These are agonists. Agonists. What are agonists? Agonist is a substance that binds to the receptor and it produces a response. Okay, it will definitely bind to a receptor and produce a response. It has both affinity and intrinsic activity. I hope that you know what is affinity, what is affinity, and what is intrinsic activity. Intrinsic activity. So this drug Who is doing this? Okay, so this so any drug which is acting as agonist, it will be having what affinity as well as it will be having intrinsic activity. In case you don't know what is affinity and intrinsic activity, let's discuss that. Okay, so affinity is nothing but ability of a drug to bind the bind to a receptor. It means this is the receptor and this is the drug. So how much it can bind to it, this is affinity of the drug. Okay, and what is intrinsic activity? It is ability of a drug to elicit a response after binding. So after binding, what particular how much action it can do, it is intrinsic activity. Okay, so I hope it is clear. So one of the example of a drug which acts as agonist can be adrenaline. Again, adrenaline. Okay, so it is basically a agonist. Adrenaline is a agonist for at what? At alpha 1 and alpha 2 adrenergic receptors. Okay, I hope it's clear. So now the second one is antagonist. Antagonists. Now what are antagonists? Antagonist, a substance that binds to the receptor and prevents the action of agonist on the receptor. Is that clear? No, a substance that will bind to the receptor and it will prevent the action of agonist on the receptor. Okay, it will be having affinity but no intrinsic activity. It means that, let's suppose this is the drug, this is the drug, and this is the receptor. This is the receptor. It will bind to it, but there won't be action. Action won't be there. Here action was there. Here action won't be there. That is antagonist. I hope so what is clear? Is that clear? That what will be there over here? Affinity is 100%, not 100%. It means affinity is there. It is positive. It is positive. And but what about intrinsic activity? Intrinsic activity, it is not there. It is absent. Okay, I hope that it's clear what is agonists and what is antagonists. Okay, so basically for drugs we have to see what how much affinity it has for a particular receptor and how much intrinsic activity it has for a receptor. Okay, now the third type of a receptor mediated action is what? Partial partial agonist. Partial agonist. Now what it is? It is a substance that binds to receptor but has, now binds to receptor, what means? Binds to receptor means affinity is positive. Affinity is there. Affinity is there. But what? It has low intrinsic activity. It means the intrinsic activity is also positive, but it is low. But it is low. Okay, so it will do what? It blocks the action of full agonist. Over here it was blocking the action completely, it was blocking, right? But over here it will block the action partially. Okay, so I hope that it's clear. Now the fourth type of a receptor mediated action is what? It is inverse agonist. What is that? It is those are the substance that after binding the receptor they will produce actions opposite to the agonist. Okay, they will be providing, and the term itself is telling that it will be providing action opposite to the agonist. So I hope that it's clear. So we'll just take an rapid overview what we discussed. So we were discussing mechanism of drug action, and mechanism of drug action can be divided into two. What are those? Non-receptor mediated action and receptor mediated action. Non-receptor mediated won't be including any of the receptor. The actions are occurring on the basis of physical, chemical, enzymes, and through the ion channels. Whereas the receptor based are having they are having the affinity and the intrinsic activities are involved over here. And the types are agonist, antagonist, partial agonist, and inverse agonist. I hope that it's clear till now. Okay, now the next part of today's session are Receptors. What are receptors? We'll be seeing what are receptors. Okay. Okay. Receptors. So we already discussed what are receptors, right? What is a receptor? We have discussed. But now we will discuss that what the types of receptors. Okay. So the types are ion channel linked receptor that we already discussed in the calcium blocker. Then G protein coupled receptor. Just listen to this and just forget it. It's okay. Enzyme linked receptor and intracellular receptor. We already discussed this receptor part, so it's okay. So these were the types. Now the fourth part of today's session is what? Factors influencing factors influencing drug action. What are the factors that influence any drug action? So this is the next part we will be dealing right now. Okay. So first of all, the first factor is, of course, the concentration of drug at site. How much drug is present at that particular site, depending upon that only the action will be there. So we can say that the action is directly proportional to the concentration of drug at site. Okay, so this is one of the factor. The second one, what it can be? Of course, the receptor, isn't it? That how much receptor density is there, how much receptor density is there, and how much it is sensitive. Now we can understand it very nicely. Let's suppose that we have a drug. Wait. These are the number of, let's suppose, drug particles that are supposed to go, and these are the receptors they are supposed to be bind. Okay, so if I am having let's suppose here the number is 50 and here the number is only 30. So what will happen? What will happen? The number is only 30. So definitely the action will be what? Can you expect an action of 50? No. If there is, no, you might be thinking, if there are only 30 receptors, then what is the need of giving 50 drugs? You should give only 30. No, they will perform action. No, it's not that. Let's suppose that in your body, the body was supposed to have 100 receptors. The body was supposed, I'm just giving an estimation, just to think. The body was supposed to have 100 receptors, but due to certain conditions such as diet pattern, maybe due to some toxic effect, or maybe due to any reason, the receptors have been damaged, or the receptors are no more functional properly, and you have left only with 30 working receptors. Then what will happen? Now you are giving drug amount of 50, but receptors are only 30. The density has been reduced, so definitely the action will be reduced. Okay. Okay, now the second part is the sensitivity. Now let's suppose you are having 100 of receptors, 100 receptors, but now your receptor is the receptors that you have that sorry, just give me a second. Yeah, now the receptors that you have are unable to recognize the drug. They don't have any sensitivity, like they are not able to recognize it. Then definitely the action will be reduced. Okay, so this is one of the factor that will influence the drug action. Now let's see the third factor. It is what? Pathological state of the patient. Let's suppose that you give a drug. Okay, okay, let's suppose you give iron tablets to patient A and patient B. Okay, patient A and patient B, but this patient A developed okay, both of them were anemic and you gave iron tablets. Okay, now patient A, after maybe 40 days, you did again a CBC for both of them to check the HB levels, and what you saw is this patient A has improved, but this patient B hasn't improved. Okay, the HB levels are still the same when you started it. Then what is the thing? You have given the same drug, you are giving this approach. Okay, both are same, the conditions you seems to be same, but still it's not functioning well in the second patient. What is the condition? Maybe that the patient is having certain pathological involvement, like maybe he can have some what we say parasitic involvement can be there, isn't it? So we have to focus on that before administering any drug. To see appropriate action of the drug, we have to make sure that whether any pathological state is present or not. Because if the pathological state is present and I am just prescribing iron tablets, then definitely I won't be able to see any result on the report. Okay, so the third part is what it was, pathological state of the patient. The fourth one, drug interaction. Now this is a topic which needs little time to discuss, and I guess there are 2 to 3 minutes left, and it will get how much time is left? 2 minutes is left. So I guess we can start another session of 30 minutes and end this thing. Okay, so I'll just end this session and I'll share a link within a few minutes. We can join there and we can continue with drug interaction, and then factors modifying the drug action, and then drug dose and ADR, blah blah things. And then we'll be ending this part of pharmacodynamics today completely. Okay, thank you.